there, I'm Tiffany Wuebben, and I'm so glad you're here today with me. Patients trust us with something incredibly important, their health. And a key part of providing great care is presenting treatment plans in a way that's not only professional, but also clear and approachable. When you present a treatment plan effectively, you're not just an expert advising on next steps, you're also a guide helping patients understand the path to better oral health and why it really matters. That's powerful, and today I'm sharing strategies to help you do just that. So where do we start? First, think about the patient sitting across from you. They may have questions, worries, or even misconceptions about what you're recommending. This is where clear communication comes in. Begin by outlining the essentials of the treatment plan in simple, straightforward terms. Use visuals when possible. Maybe it's an x-ray, an intraoral photo, or even a diagram. A picture can help bridge the gap between what you're seeing clinically and what the patient understands about their own mouth. For example, instead of just saying we need to treat decay on tooth number 19, you could point to the image and say, see this dark shadow here? That's a cavity. We don't address it now, it could turn into something bigger later, and it could cause you pain or even an infection could start. You're not just telling them what to do, you're walking them through the why. But it's not just about identifying the problem, it's also about the solution. When explaining a treatment plan, connect it to the patient's well-being. For example, instead of saying you need a crown here, say that this crown will protect your tooth and make it easier for you to chew comfortably and confidently. Highlighting the benefits of treatment, like improved function or preventing future issues. This is what helps the patient see the value moving forward. And that's key. Now, we all know that patients often have questions or concerns. I mean, this happens every day, right? And that's a good thing. It shows they're engaged. The key is to be prepared and empathetic in how you address their concerns. Let's say a patient says, do I really need this? My tooth feels fine. Instead of dismissing their worry, validate it. I completely understand why you'd feel this way. It's hard to imagine that there's an issue there when you're not having pain. But what happens is there's such a small problem that if you don't take care of it, when it is small, it can cause discomfort later and cause bigger problems. But if left untreated, this is what happens. And so taking care of it now can save you time, money, and unnecessary discomfort in the future. This approach answers their question while also reinforcing your recommendation. And that is huge, making the time to go through that process with the patient. Now, here's another common one. Patients hesitating about cost. This always happens. It's a patient says, gosh, that sounds super expensive. It's easy to feel caught off guard, but this is an opportunity to show compassion and problem solving. You might respond with, I completely understand. Healthcare costs can be daunting, but I want to make sure you're getting the care you need. So we'll go over your insurance benefits and discuss payment options and make it very nice and comfortable for you. How does that sound? So when you hear the patient and you show empathy, you're going to get a different result. Addressing financial concerns proactively and not with judgment keeps the conversation constructive and reduces the chance of the patient feeling overwhelmed and not at ease. So consistency is another game changer. When presenting treatment plans, if multiple team members are involved, you want to be consistent. We've got to make sure that the patient care is consistent and that everybody's on the same page. Mixed messages, even about tone or phrasing, can confuse patients and make the treatment plan seem less credible. A well-aligned team is key to building trust and ensuring patients feel confident in their care. And finally, don't forget to check in with your patient throughout the discussion. Don't just ask, do you have any questions, which can sometimes lead to a quick no, because patients might not want to feel like they're taking up more of your time. Instead, ask something like, what are your thoughts on this so far? Does this make sense to you? These open-ended questions invite conversation and give patients the chance to voice their needs or doubts, or if they have other questions, then they can ask it at that time. Before we wrap up, here's a quick recap of what we've covered. When presenting treatment plans, clarity and simplicity are the best friends of each other. Use visuals to explain what's happening in the way that the patient can better understand it and see it, and make every recommendation connect to their overall health and well-being. Be ready and open to answer questions with empathy, especially about necessity and cost. And always keep your team aligned so your communication style feels seamless. And don't forget, check in. Throughout the conversation, make that conversation be clear, build that trust, and that trust will lead to better acceptance of treatment plans, and the patients will get their needs met. Here's my challenge for you. Next time you're presenting a treatment plan, pay attention to the patient's reactions and their level of understanding. See if there's a way you could simply clarify it a little easier for them and have those discussions that make it even more patient-friendly. Ask for feedback from your own team too. Sometimes outside insight can shine a light on areas where we can improve. Thank you for taking the time to focus on this important topic with me today. Presenting treatment plans is such a vital part of empowering your patients, and I know you're already making a huge impact through your care. Keep refining those communication skills, and I'll see you next time. Take care.